I have exactly 1 hour before I go to work. I have exactly 1 hour. What does that mean? What does that mean is that if anybody remembers, last week I streamed for the first time in like 8 years. And so last week, I tried to take the quiz to be a certified nurse's assistant. Okay. Right? I have it right here. Woohoo, it's me.
Actually, yeah. You know what? Give me a week. Give me a week.
A week.
Okay, right now.
I failed it.
It's Wednesday,
You
January
can't even see me.
2023 at 2:30. So a week from now would be the 1st of February.
What?
1, 2, 3, 4, 5, 6, 7. Of course, every.
And what's today, guys? And what's today? As soon as I can close out of this. What is today, you may ask? Well, it's the 1st of February. Yippee! Yahoo! Wahoo! And so I have the test pulled up. It's 60 questions, 90-minute time limit, which is fine because in exactly an hour, I have to go to work. Medical school speedrun? Pretty much, actually. But the problem is that I did not do a single thing to study. It took my friend 4 months. I said I could do it in a week. And I haven't done anything. So, I am more positive than ever that I can do this. Here we go. Bam. Me, you, the quiz. 60 questions. Number 1. The resident refuses to eat vegetables with meals or as snacks. I think I've done this question. Oh no, but I don't remember. Oh, this sucks. This sucks. This sucks. Notify the nurse. I can only miss 7. I can only miss 7. A patient is experiencing dark stools. Which of the following conditions is the patient likely experiencing? Oh, oh. G.I. Joe bleeding. You're performing CPR on an adult patient. Now, wait, should you probably provide CPR? Uh-oh. Oh, I thought this was going to be the same question as last time. Wait, I can think of this. The Staying Alive song, everybody knows that. You do that for a minute. How many in 10 seconds? Ha, 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 ha. Staying alive, staying alive. Ha, ha. That didn't help me at all. 60 to 100. This sucks! That's fine. That's fine. We missed one. That's fine. You have a patient that is on the bowel regimen, but he has not had a bowel movement in 4 days. What is your next step? I thought these questions would be a lot easier. Water. Report it to nurse, of course. Why, as a nursing assistant, why do I take action in charge? This is how I speedrun failing nursing. Contact precautions include what? Mask, gown, gloves, gown, mask, gown, gloves, face shield, mask, gown, gloves, face shield, shoe covers. Do shoes count as contact with the floor, or is it contact with the person? Mask, gown, gloves, shoe covers. This sucks. Oh my god. I've already missed 3. You have a resident on day shift that is refusing a shower. He has not showered in 3 days. How will you respond to the resident? I remember getting this question last time. Do I remember the answer? No. I remember picking this one. And then I remember going, so it has to be this one. Okay, good. Has a right not to take a shower, so you have a right to be stinky. The patient uses a cane for ambulation. How should you assist this patient? Stand on the weaker side. I was imagining like one of those stock photos where they're like right next to like the grandma. What is the proper measurement for measuring body fluids? It is, of course, fluid ounces. It's fluid. It's, of course, milliliters. And if you get that wrong, you're actually stupid. I can only miss 3, and I'm 10 questions in. I didn't say I had to get it first try. Which of the following should be included when beginning to reposition a patient higher in bed? Raise head. Or suck the head. I hate you. Actually, you know what? I'm gonna take this. I blocked you on Discord. You're so mean to me, I blocked you. That's it. I just had to say that. I do. I have beef with you. What did I do? Oh, and you don't even remember. Of course you wouldn't remember what you did. No, it's whatever. I'm just trying not to injure my client here. You have a patient that has recently been to his oncologist. I know what that is. The oncologist informed the patient's daughter that the patient's cancer is back. The daughter informs you of this, but asks you not to tell the patient. How would you approach this situation? Tell the patient's daughter that she must inform the patient of his diagnosis. You report it to the adult abuse hotline. It's probably that last one. This is not a nurse. Peep this right. Oh! Encourage the daughter to report the patient of the diagnosis because the patient has a right to know. You can just withhold it? This sucks. I hate minion mail. I actually hate minion mail too. 3, 4, 5, 6. I can't miss one more. You're performing CPR on an adult patient. What is the correct depth per compression that you should use? 1 inch, 2 inch, 1.5 to 2.5, and 2.5 to 5. What compression is that? 5 inches down? Ah, oh, I'm gonna break your ribs. Oh, it has to be 1.5 to 2.5. I just feel like 2 is too long. I've already failed. I've already failed. I've already failed. 2's in between the numbers? Yeah, you're right. But it's just 2. You can't go 1.5. You can't go 2.5. There's no room for error here. There's no room. If you make one mistake, they take your certification from you. I hate you. I hate you. I hate you, Mel. You right there. This is so annoying. This is so annoying. I already failed. Oh, it's so frustrating. And so we're gonna take this certified nursing assistant test today, guys. That's right. We're doing this first try because I did this last week on the 25th, and it's been 1 week, and I said I'd do it today. So we're gonna do it. I hope you get banned from every hospital. Yeah, well, watch me pass, nerd. Bam! This is literally so easy. You can't restrain people. It's against the law. Probably. Which of the following should be included when beginning to reposition a patient higher in bed? We already know this, baby. Just lower the head. You have a 75-year-old patient that has multiple bruises in different stages of healing to the torso, arms, and back. What? It probably was the first one? This is literally so easy. This is actually so easy. You have an infant that you are carrying on for your unit. What is the most accurate way to retrieve a temperature on this patient? Oh, it's probably rectally. Yeah. Resident's room is sloppy, and the resident won't tidy up. Oh, I did this last week. I don't remember it at all. You can't touch their stuff, right? Safety hazard, probably. In the way, of course. CNA measures the blood pressure of a client to 200 and 180. I don't know what that means. The client is not in distress. What does the CNA do? You obviously gotta immediately notify the nursing supervisor. This is so annoying. Ensure the blood pressure cuff is used the correct size and repeat the measurement. Oh, so I'm just wrong here? What is the proper measurement for measuring bodily fluids? Actually, milliliters. You're stupid if you don't know that. If you're using a pulse oximeter on a patient, you should know a pulse oximeter is used to measure what? OxyClean, oxygen. It measures the amount of O2 in the patient's blood. If you have O2 in your heart, you're probably dead. Which of the following are important for the care of the diabetic patient? Giving the patient a heating pad for his feet when they're cold. Soaking his dry, calloused feet. Soaking his dry, calloused feet in a warm tub daily. Become a Twitch stream rapper and have public beef with me? I'm actually down. You'll see me drop bars like there's no tomorrow. You're providing education to a female resident about proper perineal care to promote self-care. You explain to your patient that it's important to wipe from the front to the back to prevent bacteria from spreading from the rectum to the what? Urinary medius. I'm even gonna use this in my rap to destroy you. Producing these bars faster than Willy Wonka. I can tell Melanie actually wipes back to front. Watch your urinary medius. I wipe top to bottom? Upon finding some unlabeled pills in the nightstand, the CNA should pop them. Notify the nurse immediately. Of course, they're unlabeled. Which of the following happens when a patient has a stroke? I thought it was all of these. Well, this one doesn't say may, so... How can you say which of the following happens and then say may have a drooping? This is a seizure. Never mind. I'm done with you guys. I'm not reading chat anymore. Patient is lying in a supine position. I know what that is. In what position is the patient's bed? Supine. Let me think about this. Supine. Peen. Supine. Pine. Fine. Fine. 90 degrees. No. Fine flat. Fine tilted. Fine 45. Tilted like towers upside down at 30 degrees. You're telling me a peen made this soup maybe in a position it is actually 45 degrees. It's gotta pick flat. Oh, that's so stupid. I dip my peen in my soup to know how hot it is. You have a patient that is on bowel regimen and has not a bowel movement in 4 days. You obviously got to report this to the nurse in charge. That's not normal. It's constipation. You have a resident on a day shift that is refusing to shower. All you got to do is explain to him that it's right not to take a shower. You try again tomorrow. This is so easy. Bed making technique includes eliminating wrinkles in the sheets. The CNA should know this technique assists. What? Pressure sores, obviously, because if there's wrinkles, it'll hurt you. It's like when you lay down in bed and then take a nappy wappy, and it's like the hardest nappy wappy of your life, and you wake up with like little lines on yourself. I assume that's what that is. You, as the CNA, right after this quiz I will be, see a nurse give a patient milk, which the patient is allergic to. This nurse has been made aware of the patient's allergy multiple times and has been asked to stop giving the patient milk on several occasions. What is your next step? Tell my nursing supervisor. I'm not involved in this. The nurse has a diarrhea fit. A resident is hitting and kicking you while another CNA are trying to provide care. What should you do? Tell the patient they better stop hitting and kicking. You better stop. Ask the second CNA to get a nurse. That's fine. We're learning. A resident is acting out or having behavioral disturbances. The certified nursing assistant is aware that the action should be taken first. You probably isolate them. Provide for patient and staff safety, which is what I'm doing by isolating them. 2 unmarried residents are cuddling in the common area? That's absolutely disgusting. Enjoy your company. Which of the following interventions should the CNA use to promote skin integrity? Bad bony promises when in bed. Bad bony promises when in bed. Leave Ted's stockings on during the night. Who's Ted? Probably Pat? You're performing CPR with a second rescuer available to you. You're performing chest compressions. The second rescuer is giving oxygen via bag and mask. What rate should the second rescuer provide breaths? It's actually... 1 every 5 to 6 seconds. Oh, I failed again. The second rescuer should know how to do their job, not your problem. Actually true.
It's 1 every 6 seconds. I said 1 every 5 to 6. That's the same thing. Why does that have to be so specific? If you're like 0.1 of a second behind, they just die immediately. And welcome to the first try of the 60-question CNA nursing assistant test. Add an option to every question. E, literally not my problem. Actually true. Which is what half of these are, actually. It's like, oh, what do you do? Just tell the nurse. Am I gay quiz when? Every link is purple. Hold on, I'm getting a FaceTime. Oh, this better be important. What the hell? I'm gonna call my friends. It says, "Hope you never be a nurse." You really bad. I'll show you. I'll show all of you. What did I do? This is my first try. I haven't done anything yet. Calm down, people.
Listen. I don't know what to say. This sucks. This hurts my feelings. I have 20 minutes left. And if I can't do this, then we just retry. There's no problem. We just retry. We do it in another week. We do no more studying, because that's stupid. Only idiots study. Right? You hear me? If you ever studied, you're an idiot. I hate you. You're stupid.
And welcome to the first try of the CNA practice test. Now, I did this a week ago, and I failed. I didn't get past question like 16, and I failed. So, we're going to try it again. I haven't studied at all, and it's been a week. So this can't be that hard. And if you ever fail taking a free CNA practice test, you're probably really smart and handsome. Which of the following would the CNA anticipate participating in the start of a client care during the shift assignment, administering intravenous medication, dressing a wound, assisting with bathing? Obviously, you assist with bathing. That's all I do. That's all I do all day, every day. I work at a bathing store. CNA is asked by another CNA to help you get a resident up for the floor. Is not told what happened. You help but report the event. You always report everything you do. If it says report, you report. Self-report. Among Us. Sus? Everybody type sussing in chat. Thank you. You're performing CPR. It's 2 inches. Go any more, you die. Which of the following represents the correct selection for size and blood pressure?
Correct selection size for blood pressure cutoff? It's probably
completely in circles. 40. I thought 40%, but that seems low. Transracial Asian affirming eye surgery vlog when? Stop spoiling my content. Later. Oil London inspo board making stream when? I'm continuing. Patient is lying in a supine position. It's actually flat. If you don't know what supine is, oil. Yeah, oil. What's wrong with that? Ollie. Oli. Casey Foxeye snatched kawaii sexy dragon lady tutorial. You're providing education of a female resident about proper prenatal care. Urinary meatus. 2 unmarried residents are cuddling in the common area. That's disgusting. You have a patient experiencing the end of life. What would you expect the plan of care to include? Experiencing the end of life. They're just dying? You just bury them. What are these answers? Probably that one. Of course. Easy. He's in his Wiggles era? This guy wants to be a nurse so bad. Actually, no. Just because I think it's easy. Because it took you 4 months, it takes me 1 week, baby. Maybe half an hour, huh? Maybe an hour total. That's all it needs. If a patient on a strict precautions, the cafeteria sent her up a lunch tray. What item should you question if it arrived? What's so common about all of them? Mashed potatoes, jello, and applesauce are kind of like not liquid compared to regular orange juice, baby. Of course, they will require thickened liquids. The kitty cat needed out. He left, let's send him a bomb. Lactose intolerant challenge stream. I'm not lactose intolerant. Caesar salad taste test. Okay, that will destroy me. Caesar salad taste test when no bathroom edition. Why are you trying to kill me? Contact precautions include wet gloves and a gown. Nothing else. Sneeze on them if you want. You have a 70-year-old patient that is usually pleasant and easygoing. Today she has cognitive delays, is hitting and kicking, and does not know who the staff are. Which condition is the patient likely experiencing? A UTI, a headache, a sinus infection, or hunger? This question is actually hard. Does not know who the staff is? Maybe a headache? Has to be a head thing. Cognitive delays? Sinus infection? That's with your sinuses. It's probably a headache. A UTI? UTI older cause significant acute cognitive impairments. I had no idea. Oh my god. Which of these are important for the care of a diabetic patient? Giving the patient a heating pad. Oh, you just keep his feet going. Give him socks. Fortnite ninja socks. The resident is hitting and kicking you while nurse CNA is providing care. Ask the second one to get a nurse. But of course. Which of the following should be included when beginning to reposition a patient higher in bed? You lower the head of the bed. What is the proper measurement? Is milliliters. But of course, this is so easy. Patient is experiencing dark stools, GI bleed, gastrointestinal. Patient's room is sloppy and the president won't tidy up. Some things are a safety hazard. You better pick the shit up. You have a resident on day shift that is refusing to shower. Explain that it is his right to not take a shower and you can be stinky if you want. You assess your patient. It has a fever of 102, 101, and most likely has what? An infection. Ladies and gentlemen. And this is the last question. Which is the best way to tape an apical pulse? To the right of the sternum underneath the clavicle, on the back of the fifth intercostal space, to the right of the sternum at the fifth intercostal space of the midclavicular line, to the left of the sternum at the fifth intercostal space. But it doesn't matter, baby! It doesn't matter! It doesn't matter because we passed already! You see that? 1, 2, 3, 4, 5 is all I missed, and how many can I make? What? 7 total, baby. 7. That means we passed. We passed. We're a winner. We're a certified registered nurse's assistant, baby. Let's go! I'm a little lightheaded. Who? Me. That's right. And 3 minutes to spare before I had to go to work. Bozo, you're literally speaking to a nurse here. Please. Out of my way. Come on. I'm ending stream. I'm ending stream. Oh my god. You guys can't.